Families here in Michigan are worried about losing medical care that they need following an upcoming change to the auto no-fault reform next week.
And we do have a significant update for you this evening. The state legislature is finally taking action on a potential temporary fix. Fox 17's Michael Martin covers that for us tonight.
We're at the 11th hour here.
Now just a week away from when the next portion of our state's no-fault auto reform law goes into effect, and finally, some possible light at the end of what's been a long, dark tunnel.
It's unfortunate that we had to go through the angst of this whole thing, but I really believe that we'll get where we need to be.
Survivors of catastrophic auto crashes have for months now voiced their concerns about changes set to take effect on July 2nd.
You are not a number.
Through rallies, letter-writing campaigns, and time spent posted outside the House and Senate chambers to talk directly with lawmakers, asking them to take action to stop two particular items in the new law from taking effect.
We've received hundreds, over probably 1,000 at this point, emails in my office alone from families and providers saying they're very concerned.
Concerned because this portion of the law will slash the amount of money insurance companies will have to reimburse local care providers for any post-acute medical care that's not covered by Medicare by 45% of what they were being reimbursed in 2019. It also caps the amount of hours that family members can provide care for a survivor to 56 hours a week, creating a scenario where, if it takes effect, it could financially devastate care providers.
That impact over 650 patients across the state and cause over 1,400 healthcare workers to lose their job.
Advocates say it will threaten their access to quality medical care. But on Thursday night, the state's House voted to approve a $10 million fund that would help cover costs incurred by care providers that will no longer be covered by insurance companies. While that still needs to go to the state Senate, there was yet another bill introduced by Representative Julie Rogers this week that would delay these reimbursement rates from going into effect for a full year.
It's a very simple bill. I didn't want to make it convoluted and complicated. It literally delays implementation of that fee schedule cut, as well as the 56-hour cap on families for providing care for their loved ones. It just delays that for 1 year. This would be taken up and voted on in the next week. Then we would have more time in the fall to kind of really hone down on policy and get it done correctly.
Rogers' bill, which has support from both sides of the aisle, is also being backed by the Michigan Brain Injury Provider Council.
This bill provides that relief for providers to take a breath, continue their operations as normal, continue the quality services that the patients need in their programs and in their own homes. And it gives the legislature that time to work with providers, work with the insurers to figure out a long-term solution in a bipartisan manner.
Michael Martin, Fox 17 News.
And the $10 million approved by the House would be available on a first-come, first-served basis. Providers would also have to prove a deficit caused by cuts to reimbursement rates.